listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, what does Medicare cover for beneficiaries with diabetes? We break down treatments, supplies, and services and how they're covered by the different parts of Medicare so you can help your clients know what to expect. Navigate Medicare drug and durable medical equipment coverage for diabetes, written by Isabel Vitale. You can expect 1/3 of your clients to live with diabetes. Are you helping them get coverage for what they need every day? According to the American Diabetes Association, with almost 29% of Americans over age 65 struggling with diabetes, it's likely that you already have clients asking you about coverage for blood sugar medications and supplies. How Medicare covers the cost of diabetes treatment can be confusing, given that different Medicare parts cover different aspects, and that doctors prescribe a variety of management options. Another stat to consider: the American Diabetes Association also reports that the average person with diabetes could easily spend around $7,900 annually treating the disease, even if they have health insurance. Therefore, it's imperative for you to help your clients with diabetes navigate coverage effectively. That starts by knowing the basics of Medicare's diabetes coverage. With either the combination of Original Medicare, a Medicare supplement, and a Part D prescription drug plan, or an individual Medicare Advantage prescription drug plan, your clients should receive the comprehensive coverage they need for their diabetes. Know what you can expect your clients to need and how much Medicare Parts B, C, and D will cover. And just a quick note here before we get into the details. We're not covering Part A since that is hospital care coverage. If your clients receive diabetes care in the hospital, Part A should help cover it. That being said, we've divided coverage up by drugs, equipment, and services for clearer organization. And then later on in the episode, we'll talk about how Medicare supplements, or MedSups as we call them, can provide further coverage for Part B. For the most part, your clients taking insulin will have very comprehensive coverage at a manageable price, thanks to the Inflation Reduction Act. That legislation capped monthly insulin cost under all parts of Medicare to only $35 per month. First up, we'll look at insulin used in durable insulin pumps, which can be covered by Medicare Part B or Part D. Beneficiaries pay no deductible, and their monthly copay is capped at $35, which will cover a 30-day supply. For a 60-day supply, beneficiaries will pay $70, and a 90-day supply will cost $105. Next on our list, other forms of insulin. We have injectable insulin, inhalable insulin, insulin patches, and insulin for disposable pumps, which fall under Medicare Part D coverage. Beneficiaries would not pay a deductible, and their monthly copay would also be capped at $35. 60-day supplies would be $70, and 90-day supplies would be $105. So to recap, as far as insulin goes, the type of delivery method might differ, and that determines whether Part B or Part D covers the drug. But the cost for beneficiaries, that's structured the same. Insulin isn't the only drug used to treat diabetes, though. So let's talk about some of the other anti-diabetic drugs your clients may be prescribed. All of these drugs fall under Medicare Part D, and coverage depends on the individual plan formulary. Plan deductibles, co-payments, or co-insurance may apply and differ from plan to plan. Dipeptidyl peptidase 4 inhibitors like sitagliptin, incretin mimetics such as Byetta, Januvia, Janumet, Victoza, and Onglyza, metformin, SGLT2 inhibitors such as Farxiga and Jardiance, sulfonylureas like glyburide or glipizide, thiazolidinediones like Actos or pioglitazone, and GLP-1s such as Ozempic or Mounjaro. And just a quick mention on GLP-1 medication coverage in Medicare. Here on the podcast, we've been covering CMS attempts to broaden access to GLP-1 coverage in Medicare and Medicaid with their Balance model. The start date for Balance was pushed back from May 2026, and because Balance was pushed back, the GLP-1 bridge demonstration was extended to further bridge the gap. Some beneficiaries may have access to GLP-1s via that program, but I do want to caution agents. Neither program guarantees coverage for all Medicare beneficiaries. There is coverage criteria to be aware of, and we have gotten into that information in a previous episode. We will have the link to that in our episode notes. Now, let's move on from the prescription drugs used to treat diabetes to the supplies your client may need and how Medicare covers them. Supplies for treating diabetes fall into two buckets: durable medical equipment, or DME for short, and non-durable supplies for the administration of insulin. We'll start with DMEs, which mostly fall under Medicare Part B. This includes all prescribed DME sourced from a Medicare-approved supplier accepting assignment, including blood glucose testing supplies, for example, test strips and lancets, durable insulin pumps and the insulin used in those pumps, and therapeutic shoes and inserts. There could potentially be limits on how much or how often this equipment is able to be supplied. As far as what your client can expect to pay, they will have to pay their Part B deductible, and then after they've met that amount, your clients will pay 20% of the Medicare-approved amount on their durable medical equipment. An exception to this rule: if your client uses insulin with a traditional pump that is covered as DME, the insulin is exempt from the Part B deductible, and their monthly copay would be capped at $35 for a 30-day supply. If your client has a prescription for a 60 or 90-day supply, they would pay $70 or $105 respectively. Non-durable supplies for the administration of insulin fall into the Medicare Part D bucket. These supplies include syringes, needles, alcohol swabs, gauze, inhaled insulin devices, and certain insulin pump devices that are not covered under the Part B DME benefit. The cost your client will pay for Medicare Part D covered supplies will likely vary. They'll have to meet their plan deductible and will also potentially pay co-payments or co-insurance depending on their Part D prescription drug plan. Depending on the supplies your client uses and how they're covered in Medicare, the price of managing their diabetes will vary. For example, say you have a client who takes injectable insulin. They're on original Medicare. They have a MedSup, but they don't have a drug plan. Their insulin would be covered completely because the MedSup will cover the remaining $35, but that client will owe 100% of any supplies needed for the administration of their insulin, like syringes, needles, and gauze. Your clients may also ask about whether Medicare covers certain services, like education and screenings related to their diabetes. Diabetes services fall under Medicare Part B, but they're not always covered outright. Usually there are some conditions around how they are covered by Medicare Part B. We'll start out with foot exams and treatment. We know foot care is very important for those with diabetes. Medicare may cover a foot exam every 6 months if your client has diabetic peripheral neuropathy and loss of protective sensation, and they haven't seen a foot care professional for another reason between visits. The Part B deductible will apply, and Medicare Part B will pay 20% of the Medicare approved amount after that. Medicare may cover glaucoma testing performed by a doctor legally authorized by the state once every 12 months if your client is at high risk for glaucoma. Same as foot exams, the Part B deductible will apply. Once that's met, Medicare Part B will pay 20% of the Medicare approved amount. Medical nutrition therapy, or MNT services, and certain related services may be covered by Medicare for those with diabetes or kidney disease if a doctor or other healthcare provider refers your client for the services. If the doctor or healthcare provider accepts assignment, your client will not be responsible for a copay or coinsurance, and the Part B deductible does not apply. The Medicare Diabetes Prevention Program is a once-per-lifetime health behavior change program to help prevent diabetes. If your client is eligible for the program, they will not pay to participate. What about diabetes screening tests? Medicare beneficiaries may be eligible for up to 2 diabetes screening tests each year if their doctor determines a risk for diabetes. Your client will not be responsible for a copay or coinsurance, and the Part B deductible does not apply. And then for those who are diagnosed with diabetes and want to go through self-management training, for Medicare to cover self-management training services, your client's doctor or another healthcare provider must order it, and your client must go through either an accredited individual or program. The Part B deductible does apply to self-management training for those with diabetes. Afterwards, your client would be responsible for 20% of the Medicare approved amount. Beyond what's covered by Medicare for the treatment of diabetes, there's another important reminder I have to mention, and you've heard us say this repeatedly here on the show. No matter what type of client you're working with, effective coverage starts the moment you begin talking about coverage. When your client begins asking questions about diabetes coverage, your first step is to fact-find thoroughly and appropriately. Without knowing what your client takes or does to manage their diabetes, you won't know what plans will work best. This is some information we suggest finding out from your diabetic clients. When they were diagnosed with diabetes, what they currently use to manage it, like the type of insulin taken, if any. Are they injecting it? Do they inhale it? Is it a patch? Is it administered from a pump? If they're using a pump, is it a durable pump or a disposable pump? Get the specific names of anti-diabetic drugs taken, if any. Find out what supplies they need regularly. We've mentioned a few of these already. Items like syringes, gauze, alcohol swabs, test strips, and lancets, to name a few. What other equipment do they need? Take note of their primary care provider and pharmacy of choice. Ask if and what screenings and tests they receive, if and what educational resources or trainings they utilize, if and what other complications or chronic illnesses they have resulting from diabetes. And don't forget that if they're not receiving screenings, tests, or education, ask if they would like to. If your client comes to you with questions about coverage in the first place, they will likely be prepared to provide this information. But as always, we encourage agents to be sensitive when fact-finding. Preface questions with a statement about how the answers are imperative to helping you recommend the plan that meets their unique needs. What you learn from fact-finding will determine what plan or configuration of plans will work best for your diabetic clients. Since an MAPD plan or the combination of original Medicare, a MedSup, and a Part D plan will both offer similar coverage for diabetic medications, supplies, and services, your recommendation might come down to other factors like complications due to diabetes, drug formularies, budget, or priorities. As a rule, whenever a plan has a drug formulary, and we're thinking Part D and MAPD plans here, consult it diligently. If your client has been taking a certain anti-diabetic drug for years and wants to continue, it's imperative to find a plan that covers it. Imagine the frustration your client would feel going to the pharmacy to pick up their usual covered prescription, only to be forced to pay much more out of pocket at the pharmacy after switching to a plan you suggested. Sometimes clients are willing to switch drugs. Other times, they're not. But that's something they need to decide with their doctor. Do your formulary homework and inform your client of their options. As far as MAPD plans go, with the combination of Part B equivalent and drug coverage, this option can be very attractive for your diabetic clients, especially since some carriers offer plans without copays or coinsurance for diabetes supplies. Consult the summaries of benefits and coverage of the different MAPD plans you offer. If you don't offer any plans with $0 copays or low or no coinsurance for diabetes supplies, we recommend expanding your portfolio to offer one that does. Make sure your portfolio has a variety of options to suit the needs of a diverse set of clients. I can't mention Medicare Advantage options without also talking about C-SNPs, short for Chronic Condition Special Needs Plans. This option can be a wonderful choice since some are designed especially for people with diabetes. C-SNPs could offer additional coverage and services on top of traditional MAPD plans, like customized prescription benefits, coordinated care management, educational resources, and complementary benefits. A C-SNP could very well be the right choice for diabetic clients, especially those with severe cases or complications. This type of special needs plan may include benefits to cover essential services, providers, medications, and specialized care to better serve your diabetic clients. And just a quick note here, C-SNP availability and pricing varies by market, so make sure to help your client compare their options. Now, what about the combination of MedSup and Part D, in addition to original Medicare? This pairing may offer the same general coverage as some MAPD plans. A MedSup can be especially useful for covering the remaining 20% Part B coinsurance for diabetes durable medical equipment like pumps. If your client relies on an insulin pump, a MedSup might be the right fit. We don't recommend not opting for a Part D plan to save on premiums, since your diabetic client could benefit from all a drug plan would help cover, including different types of insulin, other anti-diabetic drugs, and supplies like syringes, needles, and gauze. Keep in mind, even though the Part D penalty is considered a late enrollment penalty, it can still be levied if a Medicare beneficiary goes without creditable prescription drug coverage for 63 or more consecutive days, And that penalty is permanent. There are no penalty exceptions. Also important to remember, if your client wants a med-sup, but they've missed guaranteed issue periods, they'll need to pass underwriting to join one. Luckily, carriers recognize the prevalence of diabetes and may not deny enrollees automatically because of it, although they will have parameters. Finding the right plan for your client doesn't need to be a time-consuming and intimidating process, though. As a Ritter agent, you'll have free access to Integrity's all-inclusive CRM, IntegrityCONNECT. Within this powerful platform, you can import your client's current medications, doctors, and current conditions. And when you have the information we've been talking about today in their client profile, you can also use Ask Integrity for informed plan suggestions. And it is easy to prompt Ask Integrity in IntegrityCONNECT with a voice prompt or by asking a question. One important takeaway we would like to stress today. Remember that your clients may not be aware of the full breadth of tests and services that Medicare will cover for diabetic beneficiaries. Let them know about what's available to them and encourage them to take advantage of their Welcome to Medicare visit, their annual wellness checkups, and any covered foot exams, glaucoma tests, and annual screenings as instructed by their doctor. Point out covered nutritional and self-management services. Mention the Medicare Diabetes Prevention Program for any of your clients with pre-diabetes. Now, you and your clients will inevitably have more questions. Will Medicare cover supplies automatically sent by a supplier? Does your client need to ask for refills? How many test strips and lancets can your client get? We will have the links to several additional resources from the Centers for Medicare and Medicaid Services in our episode notes. There's the Medicare Coverage of Diabetes Supplies, Services, and Prevention Programs booklet, the Medicare Coverage of Diabetes Supplies fact sheet, and 5 things to know about Medicare insulin costs fact sheet. All of those are linked in the notes, and if you still can't find the answers you need, reach out directly to Medicare at 1-800-MEDICARE or contact the plan provider. Some other resources I want to mention here that are also helpful depending on your next steps. If you heard this episode and you're not sure if your portfolio has all the contracts and products it should, here at Ritter Insurance Marketing, the FMO that powers this podcast, we offer free portfolio reviews. And should you determine that you need to add a product, we can help you get squared away with your next steps after the review, like getting contracted with a new product and learning all about it with our ebooks and training webinars. And I will say we have some excellent options for your diabetic clients. So reach out to our team. Let them know where you're at and where you want to go, and we can help you get there. Thanks so much for taking the time to listen to this installment of our Agent Survival Guide podcast. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Isabel Vitale and proofed by Emily Ryan. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Like what you heard in this episode? Follow along with our show. It really helps the pod.